In our last conversation, I shared with you a simple 10-minute daily routine that has already helped so many women over 60 reconnect with their bodies and preserve their intimate health. Many of you wrote in the comments that you felt encouraged to try it, and some of you even shared that you'd started breathing exercises or gentle Kegels. That makes me so proud. But alongside that encouragement, I also saw the same question repeated over and over, Dr. Perriera. What do I do about dryness? What do I use? Is it a moisturizer, a lubricant, or estrogen? I feel lost, and I want to tell you, if you've ever stood in front of a store shelf, confused by all the boxes and bottles, or wondered whether it's safe to use estrogen cream after menopause, you are not alone. In fact, this is one of the most common sources of frustration for women in their 60s, 70s, and even 80s. I'm Dr. Lisa Perriera, a gynecologist with over 30 years of experience, and today I want to give you a clear, compassionate guide to the options that actually work for vaginal dryness after menopause. Because dryness is not just uncomfortable, it can quietly affect your confidence, your mood, and your relationships. And here's the good news: there are safe, effective, medically recognized solutions. We'll talk about the difference between a vaginal moisturizer and a lubricant, why they are not the same, and when each is appropriate. I'll also explain the role of low-dose vaginal estrogen, who it's right for, who should avoid it, and how to have an informed conversation with your doctor. And I'll share a real patient story of how choosing the right product transformed not only her comfort, but her ability to rejoin the parts of life she loved. So stay with me until the end, because I'll also give you a simple 4-week plan that will help you test track and adjust your routine so you're not guessing anymore. But first, let me ask you something important. Have you ever told yourself, "I'll just live with it. This must be normal at my age"? If so, I want you to pause right now and hear me clearly. Persistent dryness is not a sentence you must accept. It is a medical condition with proven, accessible treatments, and you deserve to feel comfortable again. Now let's begin by looking at the first common mistake women make when facing dryness, confusing moisturizers with lubricants. When women first notice dryness, they often rush to the pharmacy or search online and buy whatever product looks most promising. But here's the truth: many women end up using the wrong product in the wrong way and then feel disappointed when nothing improves. Let me walk you through the most common mistakes I see in my office, because once you recognize them, you can avoid years of unnecessary discomfort. The first mistake is confusing moisturizers with lubricants. A moisturizer is like lotion for your skin. It hydrates and nourishes tissues over time. It should be applied several times per week, even when you're not being intimate. A lubricant, on the other hand, is like cooking oil in a pan. It makes movement easier in the moment, but does nothing to restore long-term comfort. Too often, women rely only on lubricants, thinking they're treating the problem, when in fact they're only easing it temporarily. A patient once told me, "Dr. Perriera, I've been using a lubricant every night, but my tissues still feel paper thin." That's because her body wasn't getting the hydration it truly needed. The second mistake is choosing a product with fragrances, dyes, or harsh ingredients. Our culture markets so many feminine hygiene products that promise freshness, but in reality, they irritate delicate tissues. After menopause, the vaginal walls are thinner and more sensitive. Using scented gels or harsh cleansers can actually worsen dryness and burning. The North American Menopause Society recommends sticking to unscented, pH-balanced moisturizers designed specifically for vaginal health. When in doubt, simpler is safer. The third mistake is ignoring low-dose vaginal estrogen when it's appropriate. I meet many women who have heard the word estrogen and immediately worry about risks like breast cancer. Those fears are understandable, but here's what the science says. Low-dose vaginal estrogen, when prescribed and monitored, is not the same as taking hormone replacement pills. According to the Mayo Clinic and Cleveland Clinic, local estrogen works directly on vaginal tissues, restoring elasticity, thickening the lining, and increasing natural lubrication with minimal absorption into the bloodstream. For many women, especially those with severe dryness, moisturizers alone aren't enough. Yet because of fear or misunderstanding, they never discuss this option with their doctor. Of course, estrogen isn't for everyone. Women with certain cancer histories, blood clot risks, or specific medical conditions need careful evaluation. But avoiding the conversation entirely means missing out on one of the most effective treatments available. If you're unsure, the safest step is always to bring it up with your provider. A thoughtful discussion can clarify whether it's right for you. The fourth mistake is waiting until pain becomes unbearable before taking action. I've seen too many women who suffer in silence for years, telling themselves, "It's just aging." They only seek help once intimacy becomes impossible, or when dryness causes cracks and infections. By that point, tissues are often so thin that progress takes longer. One woman I'll call Carol came to me at 71. She had stopped intimacy altogether because the discomfort was too great. When we began treatment with moisturizers and low-dose estrogen cream, her improvement was slow at first. After 6 months, she felt relief, but she told me with tears in her eyes, "I wish I hadn't waited so long." Her words stay with me because I see the same story again and again. And finally, there's one more mistake that often goes unspoken: shame. Many women feel embarrassed to buy these products, to talk about them, or even to admit they're struggling. That silence keeps them from discovering the solutions that are already available. But remember, this is not indulgence. This is healthcare. Your comfort is just as important as your blood pressure or your cholesterol. So if you've ever made any of these mistakes, confusing moisturizers with lubricants, choosing irritating products, avoiding low-dose estrogen out of fear, waiting until pain takes over, or staying silent out of embarrassment, I want you to know you are not alone. These are patterns I see every week in my office. But the good news is, once you know better, you can do better. And the relief that follows can be life-changing. In the next part, I'll show you exactly how to choose the right option for your body, how to build a simple 4-week plan, and what signs to watch for along the way. This is not guesswork. It's a roadmap backed by science and years of clinical experience. Now that you know the most common mistakes, let's shift to the solutions that truly work. Because the goal here is not just temporary relief, but long-term comfort, healthy tissue, and restored confidence. To make it simple, I like to think of dryness care in 3 categories: moisturizers, lubricants, and low-dose vaginal estrogen. Each has its place, and knowing when and how to use them is the key. Let's start with moisturizers. A vaginal moisturizer is like lotion for your skin. It's designed for regular use, not just during intimacy. The best ones are water-based, pH-balanced, unscented, and free of irritating additives. When applied 3 to 4 times per week, they can help restore hydration, improve elasticity, and reduce that papery feeling many women describe. I often tell my patients, think of it like conditioning your hair. The more consistent you are, the healthier it becomes. For example, a woman named Linda, 69, began using a moisturizer 3 nights a week. Within 3 weeks, she noticed less stinging when she sat, and by 8 weeks, she told me, "I don't think about dryness all day anymore." That's the power of consistency. Now, lubricants. These are meant for the moment, whether during intimacy with a partner or during self-touch. The goal is to reduce friction and make the experience more comfortable. There are 3 main types: water-based, silicone-based, and oil-based. For most women over 60, water-based lubricants are the safest choice because they wash away easily and don't disrupt vaginal pH. Silicone-based lubricants last longer and may be helpful if dryness is severe, but they can be harder to clean. Oil-based options should generally be avoided as they can increase the risk of infection and are not compatible with certain products. A simple rule of thumb: moisturizers for maintenance, lubricants for the moment. Use them together, not interchangeably. And then there's low-dose vaginal estrogen. For women whose dryness is moderate to severe or who experience pain despite regular moisturizers, this option can be transformative. Unlike systemic hormone therapy, which circulates through the bloodstream, low-dose vaginal estrogen works locally directly on the tissues that need it. It comes in several forms: creams, tablets, and rings. Most women tolerate it very well, and improvements can begin within a few weeks. According to the Mayo Clinic, vaginal estrogen is one of the most effective treatments for restoring thickness, increasing natural lubrication, and reducing pain with intimacy. Of course, it's not for everyone. Women with certain cancer histories or clotting risks need careful evaluation. That's why it's so important to have a conversation with your healthcare provider. But for the right woman, this treatment can be life-changing. So how do you know where to start? I recommend a 4-week plan. In week 1, begin with a pH-balanced moisturizer 3 times per week. Track your comfort each day, rate your dryness on a scale of 1 to 10 in a small notebook. In week 2, add a safe water-based lubricant anytime you engage in intimacy or self-touch. Notice whether friction feels easier. In week 3, evaluate: are your symptoms improving, or do you still feel dryness daily? If you're still struggling, this is the time to talk with your doctor about low-dose vaginal estrogen. By week 4, you should have a clear sense of what's working and what needs adjustment. The key is not to guess blindly, but to test systematically and listen to your body's response. And let me reassure you, using these products is not indulgence, and it is not weakness. It is healthcare. Just as you wouldn't ignore dry skin on your hands or cracked lips in winter, you don't need to ignore dryness in your most delicate tissues. In fact, treating it early helps prevent complications like micro-tears, recurrent infections, and painful intimacy. One of my patients, Carol, who I mentioned earlier, told me after starting this plan, "It feels like I got a part of my life back." She wasn't just comfortable again, she was confident enough to say yes to activities she had been avoiding. That's the deeper gift of addressing dryness properly. So as you think about your own body, ask yourself, which of these 3 options have you tried? Which have you avoided, and why? In the next part, I'll share a transformation story that shows what happens when a woman finally chooses the right treatment for her needs. It's a reminder that relief is not just possible, it's within reach. I want to share a story with you that has stayed with me for years. A woman I'll call Evelyn came to see me at age 72. She was gentle, kind, and deeply devoted to her family. But when she sat in my office, her eyes filled with tears as she whispered, "Dr. Perriera, I feel like sandpaper inside. I avoid hugs from my grandchildren because I'm terrified they'll press on my lap and I'll feel pain." Her words broke my heart. Evelyn had been living with severe vaginal dryness for nearly a decade. She had tried lubricants from the pharmacy, but they only helped in the moment. She had never used a moisturizer regularly, and no one had ever explained to her that local estrogen was an option. She believed this suffering was her fate. Together, we started small. I asked her to use a pH-balanced moisturizer 3 nights a week, just like conditioning her skin. After 2 weeks, the burning eased. We then added a water-based lubricant whenever she felt up to gentle touch. For the first time in years, she said intimacy with her own body wasn't frightening. Finally, after careful discussion with her oncologist, she began a very low dose of vaginal estrogen cream. Within 6 weeks, her tissues were stronger, more elastic, and she could sit comfortably in her favorite chair without shifting every few minutes. The transformation wasn't just physical, it was emotional. She told me, "I feel like a door I thought was closed, forever has opened again." She wasn't talking about sex, she was talking about freedom. She went back to her weekly choir group, she started gardening again, and most importantly, she could welcome her grandchildren's hugs without fear. That single change gave her back her sense of belonging in her own body. I often use an analogy with my patients. Think of your vaginal tissues like a leather handbag. When the leather is neglected, it cracks, stiffens, and loses its flexibility. But with regular conditioning, it becomes soft, supple, and resilient again. The tissues of your body respond in much the same way. Moisturizers and lubricants are the conditioners. Local estrogen is like the deep restorative treatment when the leather has gone too long without care. None of these tools are about vanity, they are about preservation. And here's something important Evelyn taught me. She said, "I didn't realize how much I had given up until I got it back." That statement rings true for so many women. When you live with discomfort for years, you begin to accept it as normal. You stop expecting comfort, and you stop remembering how good it feels to move freely, sit peacefully, and embrace without hesitation. Then when healing begins, the contrast feels almost miraculous. I want you to know this is possible for you too. Dryness is not a punishment for aging. It is a medical condition with effective solutions. And you don't need to wait until the pain is unbearable to take action. Whether you start with a moisturizer tonight, add a lubricant tomorrow, or talk to your doctor about local estrogen next month, every step is a step toward freedom. As you listen, I encourage you to reflect. What part of your daily life has dryness quietly stolen from you? Is it comfort sitting at church, walking with friends, or enjoying the intimacy of touch? Share your thoughts in the comments, because naming what you've lost is the first step to reclaiming it. In the next and final part, I'll give you a simple recap, a hopeful roadmap, and a clear call to action. Because this journey isn't about bottles or creams, it's about you, your confidence, and your right to feel at home in your body again. We've traveled together through an important and often overlooked part of women's health. Let's take a moment to bring it all together. First, we named the problem, clearly vaginal dryness, after 60 is not something you simply have to live with. It is common, but it is not inevitable, and it is not untreatable. Second, we uncovered the mistakes that keep so many women uncomfortable. Confusing moisturizers with lubricants, using irritating products, avoiding local estrogen out of fear, waiting until pain forces action, and staying silent out of embarrassment. These are not failures. They are the natural result of decades of silence around women's intimate health. Third, we looked at the solutions. Moisturizers for long-term tissue care, lubricants for comfort in the moment, and low-dose vaginal estrogen for those who need deeper healing. Each tool has its place, and often the best results come when they are used together in a thoughtful plan. And then we saw the transformation through Evelyn's story. A woman who believed her comfort was gone forever, only to discover that with consistent care, the door to freedom could open again. Her experience shows us that healing is not just about tissues, it's about laughter, hugs, friendships, and the simple joys of daily life. So here's what I want you to remember. Dryness is not a sign of weakness or a lack of femininity. It is your body asking for care. And when you respond with compassion and consistency, your body can respond with resilience. If you are ready to take action, here's a simple next step. Choose one product, a moisturizer, a safe water-based lubricant, or with your doctor's guidance, a low-dose vaginal estrogen, and commit to using it regularly for 4 weeks. Keep a small notebook and track your comfort level each day. This is not about perfection, it's about progress. Even small improvements matter. and please share your journey. In the comments, let us know, have you tried a moisturizer before? What was your experience? Would you feel more confident using a lubricant? Or are you curious about estrogen therapy? Your story might give another woman the courage to speak to her doctor or try something new. At Elder Care Wellness, we believe women over 60 deserve honest, compassionate conversations about every aspect of their health, including the parts that are too often left unspoken. You are not invisible. You are not too old. You are worthy of comfort, confidence, and joy at every age. So if this video helped you, please give it a like, share it with a friend or sister, and subscribe to this channel. Together, we can create a community where women feel informed, supported, and empowered to thrive. And before we close, let me remind you, this video is for educational purposes only. It does not replace medical advice. Every woman's body is unique. If you are experiencing pain, significant changes, or have personal concerns, please consult with your healthcare provider. Your well-being deserves personalized care. Thank you for trusting me with this conversation. Take a deep breath. Place your hand over your heart, and remember, you are not done. You are not broken, and you are certainly not beyond care. With knowledge, compassion, and just a few small steps, you can restore not only your tissues, but your sense of wholeness.